Hello, my name is Dr. Katzen. I'm the Director of Reconstructive Plastic Surgery at Century City Doctors Hospital and Cosmetic Surgery at Tri-City Regional Hospital. My mission is to help weight loss patients complete their journey. This includes plastic surgery procedures to aid patients in looking as good as they feel.
Explore applications of technology and medicine. See how experts prevent, diagnose, and treat today's most traumatic illnesses. Discover the latest breakthroughs in healthcare on World Business Review's Health Journal Television.
Welcome to WDR's Health Journal Television. I'm Alexander Haig. When a person loses a massive amount of weight in a short period of time, their outer skin often doesn't have the elasticity needed to shrink down to their body's new shape. In situations like this, surgery may be needed. Here to discuss this is J. Timothy Katzen, MD, aesthetic and reconstructive plastic surgeon, and owner of Body by Katzen. Welcome. I'll call you Tim if I may.
Thank you, Al.
Now, Tim, isn't weight loss usually a gradual process, and how does someone typically lose such a massive amount of weight so quickly?
Sure. In the past, weight loss had been a gradual process. Two things have happened in the States that have changed a gradual weight loss. One, the explosion in epidemic proportions of obesity in the States, and newer, safer stomach stapling procedures. Those two have combined to a massive number of patients getting these gastric bypass procedures, and typically a person can shed at least 100 pounds in about 8 to 10 months.
Wow. Now, Tim, as a plastic surgeon, how do you actually help this situation?
With that massive weight loss, people develop yards and yards of extra skin. Inside those extra skin folds, these rashes develop. And to get rid of those rashes, sometimes they have to be surgically removed.
Now, for more, let's go to this Health Journal Television field report.
In the fight against obesity, millions know how rewarding eliminating excess weight can be. But losing the weight is sometimes only part of the solution to a leaner, healthier-looking body.
I had weight loss surgery April 29th, 2003, and I've lost a total of 180 pounds. And since then, I have had many reconstructive surgeries to remove all of the excess skin, which was the end of my weight loss journey, and now the beginning of my new life as a thin person.
Many times after a dramatic weight loss from a surgical procedure, additional surgeries may be required utilizing new techniques invented specifically for post-weight loss patients.
After weight loss surgery, I had reconstructive surgery in two phases. Phase 1 was the lower body lift and the bilateral thigh lift, and phase 2 was the upper body, which included both arms, the arm lift, and breast augmentation and lift.
For Health Journal Television, I'm Michael Clark reporting.
Now, Tim, why is it important to go to a plastic surgeon that specializes in this procedure, and what should a patient actually look for?
Sure. When you're looking to have plastic surgery, you need to make sure they are board certified. Board certified by the American Board of Plastic Surgery. And the other thing you want to be careful of is you want to find a plastic surgeon who has done a lot of these. What is a lot? I would say at least 100 of these procedures. Weight loss patients are very unique. They have a lot of other comorbidities that they have had. High blood pressure, diabetes, anemia, and those combined make them a higher risk type of patient.
Now, Tim, how long after weight loss surgery should patients wait before they come and see you?
Typically, a patient will lose most of their weight in 8 to 10 months after their stomach stapling procedures. I like to have patients come to see me about 6 months after their procedure. It takes a couple of months for us to get insurance authorization, and then we can proceed with the plastic surgery reconstruction at about 10 to 12 months after their stomach stapling.
Now, how long does it take to recover from a post-weight loss operation?
Now, there are two types. There is the stomach stapling, which takes maybe a couple of days, and then over the next 8 to 10 months, they shed off literally over 100 pounds. And then we think about the plastic surgery. My plastic surgery procedures I like to stage, and usually we'll wait 2 weeks between each procedure.
Good. Now, does insurance cover many reconstructive procedures for weight loss patients today?
Sure. It really depends on your insurance carrier and the problems you're having. But typically the problems that they cover are the rashes that are underneath these folds and back and neck pain.
Now, do you collaborate with a bariatric surgeon?
I use a lot of bariatric surgeon referrals. The busy bariatric surgeons send me all their patients, but patients are very savvy too. They come to me independently too.
Good. Do you have many out-of-state patients? And if so, how do you follow up with these patients?
About 30% of my practice comes from out of state. We like them to spend about a week to 10 days in Southern California, and then we let them fly back home.
Good. Can patients have multiple procedures performed simultaneously?
Sure. My number one priority is safety. I like to stage procedures. I like to keep the procedures less than 12 hours in the operating room, and I don't like to open up too many surgical fields, too many open areas, which could lead to problems.
Right. Now, how long have you specialized in plastic surgery after the weight loss procedure?
I've been doing plastic surgery on morbid obese patients for about 15 years, but in the past 6 years, I've totally dedicated my entire practice to plastic surgery after massive weight loss.
Now, what are some of the other procedures that you specialize in?
There's 7 areas that I focus on after weight loss. Typically, that's the tummy, the hips, the buttocks, the legs, the breast reconstruction in men and women, the arms, and the face.
Good. Now, how safe is plastic surgery?
It's a lot safer than it used to be. Okay? Gastric bypass patients are, again, a high-risk type of patient. I minimize the risks by having them see my nutritionist before surgery. I perform all my procedures with a board-certified anesthesiologist that just does bariatric patients, and I perform most of my procedures in a hospital.
Now, Tim, do you also treat patients who aren't weight loss patients?
Typically, it depends what procedure they're looking for. But most of my patients are weight loss patients. Minimum, they've lost maybe about 100 pounds. Maximum, I do have a patient who's lost over 800 pounds.
800?
800.
Now, what hospitals and surgery centers do you have privileges at?
I'm the director of reconstructive plastic surgery at Century City Doctors Hospital in California. I'm also the chairman of the cosmetic program at Tri-City Hospital in Hawaiian Gardens, California. And I also use about 2 or 3 surgery centers to perform outpatient surgery.
Very good. Now, at this juncture, Tim, we take our viewers into the future.
Okay.
So I'd like you to give our viewers a picture of what you see coming in this area in the next 2 years or so.
I think the future in this industry is going to be the primary care doctors, the pediatricians, the internists, the general practitioners, seeing and identifying obesity earlier. They'll see families that are higher risk. They'll see people that are starting to gain weight and think about weight reduction before it reaches the extreme, where I see my patients, and then requiring gastric bypass.
Very good. Well, the clock tells me that we're going to have to terminate this extremely important and very, very increasingly active subject. So before doing so, I want to thank you for your very fine presentation today, Tim.
Well, thank you, Al.
Very good. And thank you for watching. Until next time, for Health Journal Television, I'm Alexander Haig.